I'm Jessica Flores. I am a marriage and family therapist, and I work at the Personal Growth and Counseling Center. And my title here is Counselor Faculty.
Okay. Mm-hmm. So what sparked your interest in marriage and family therapy?
Well, so when I was in high school, I saw a therapist, and I thought that that was a pretty cool profession. And it was enjoyable for me as a client. And so it was right around the time I was applying to school, so I thought, oh, I'll be a psychology major. And then it was my senior, well, I shouldn't say that. So then in my junior year, I did an internship, and I was working at a place where there were a lot of other MFTs, and so they kind of were models for me about how I could be in the field and how I can like further pursue graduate school and actually begin to do counseling and therapy with people. So my senior year, I applied to a program and went to the program, and that was it. I really did not research the difference like you guys are doing, which is great, the difference between MFTs and LCSWs and clinical psychologists. I kind of just saw these women that I were around, and most of them were women who were doing really good work, and I liked it, and I said, okay, I'm going to do that. So,
if someone was interested in the field that you're in, what should be their first steps to get to where?
Yeah. Well, I would say go to a counselor or go to a therapist. Lots of times I think that's like the most valuable thing that I learned in my graduate program is you really can't do this work unless you've done the work yourself, especially if you're young and you're being a marriage and family therapist and you're working with couples or families. They're going to question your validity, like, well, what do you know? And so I think not that you have to tell them that you've gone on your own personal path, but I think it's just good for your own self to know, what I have done this work, and I'm just as committed to my own self-work as I'm asking other people to be. So I think that's helpful, not just in, your prior to your graduate program, but throughout, or doing something to take care of yourself. And then also doing internships. I mean, it's challenging because you're actually never going to be able to do any kind of counseling or therapy until you're in your graduate program. But if you could be in a setting where you can observe, that could be helpful. Maybe even be like, at a front desk somewhere, taking all of those 40-hour courses. Like I know the Monterey County Rape Crisis Center has a 40-hour, course around being a sexual assault advocate. Even if you think like, well, that's not going to be my specialty, it doesn't matter. You're going to learn skills, you're going to learn resources, you're going to learn how to make referrals. The YWCA has the same thing for DV. I think doing those kinds of things can be helpful.
What do you like the most and least about your job?
Okay.
If you could pick one.
Well, the most, of course, is going to be working with students or working with people and seeing that shift or that change, seeing them get to their goal. That's really exciting when you have like those sessions where things like are clicking for them, where you're not really doing any work, but they're doing kind of all of the work and getting to that place. And when we have like those sessions where we're reflecting and thinking about like what they've gone through and where they are now, and kind of where they're going. It's just really exciting, really gratifying. I have sessions where I just, I don't know, like where even we just like laugh or we even like cry. Like sometimes I'm in there crying with my clients, like, oh my gosh, you've done this, because a lot of students I see for more than, one semester. I have students who I've seen all 4 years of their time here, and so it's neat to see that kind of growth. The least things that I like, well, in this particular center, we're short-term therapy. So even though I've seen people like on a long-term scale, those are people that have maybe initially started where I see them more frequently and then I start to see them less, which is the goal of treatment or therapy, right, is that they eventually don't need your services anymore. You're working yourself out of a job, basically. But the challenging part is you know, a lot of students don't have access to treatment, and that can be really frustrating when I know we're not the appropriate place for them, but they don't have any really other options because they don't have insurance, or they do have insurance, but they don't have access to transportation to get there, or they're ambivalent to try counseling in the first place. And so then when we explain to them, like, okay, I think it's best if you go to an outside provider, and then this is what you have to do, and this is what you have to call. Like, for somebody who's ambivalent about the counseling process at all, and then they're already kind of having difficulties to then go through these other steps to get the treatment, could really turn somebody off and then unmotivate them.
Can you describe like a typical workday here?
Sure.
Yeah.
So like I'll just today, so I'm doing this, which is fun, right? So I really often do work with students who are in like the psych field or the helping profession field, either doing projects or like just meetings or small interviews, like one-on-ones. I have a meeting at 9 to do, I'm part of like a care team, so I'm working with other colleagues around campus, and I just serve as a consultant. And then 10 and 11, I have a student. I think I have an ongoing student and then an assessment, so like a new student. At noon, I have a group, first generation college student group, and that's kind of happens twice a month. So that's for students who, they don't have any family members who've been through college. That's like a support group where it's a little bit of processing, but it's a little bit of education. So it's kind of a mixture. And then at 1, I have a client. At 2, I have an ongoing client. And 3, I think I have another assessment. And then I'll probably take my lunch at 4. So
it's a really busy day.
Yeah, so it's pretty busy, but it varies. Like yesterday, was Halloween, so I had a full caseload, and all of a sudden I had a lot of cancellations. So I had 2 clients, and I had a training and a presentation, and then the rest of that time I used to do my case notes and my case management. So sometimes I overbook myself because I know that sometimes clients, and it's not just students, this happens outside of these settings too, they'll cancel or they won't be able to make it, and that's where I get in a lot of my case management time. Sometimes though they all show up and then it's like, but it's kind of this like flow, Tomorrow we have clinical meetings, so I usually have like, we try to go for a 40-60 ratio, so 60% direct services. That can be individual, group, trainings, workshops, anytime we're providing a direct service to students, and then the 40% is my admin stuff. So I'm in charge of the website, I'm in charge of our social media, I'm in charge of any kind of brochures, flyers, any kind of publicity. I'm on the care team. We have clinical meetings here. I'm in charge of a lot of the training and the outreach. So that 40% is managing those other tasks.